conversations about mental health, wellness, and life in general. This is the Self-Work Podcast with Dr. Bundi. As a psychiatrist who works with women, I often have patients who have both a mental condition but also a physical issue, and the two intersect quite commonly. For instance, we have a condition such as menopause, and it's a gynecological issue, but it definitely affects mental health. So I want to take you through a series where we will be having some specialists, friends of mine, come over and have conversations with us about the intersection between these conditions and mental health. Today we are joined by Dr. Kenya, who will be talking us through the experience of managing patients with premature menopause.
First of all, thank you for having me here. I'm so excited to speak about this topic. I'm Dr. Amanda Kenya, an obstetrician and gynecologist, sexual and reproductive health specialist. I have a special interest in perimenopause, menopause, taking care of women who are pregnant at the age of 35 years or above, and also curating a positive birth experience for women. First, let me tell you why I even got into this in the first place, right? So a friend referred her mom to me to take care of her because she had been having hot flashes for years, like 9 years after menopause. She had been treated with supplements, she had been seen by gynecologists and general doctors and endocrinologists, and she was not getting relief. And so I took it upon myself to do a bunch of research and go with her to gynecology visits and advocate for her. And finally, she's on hormone treatment and is doing way better. So once I realized that there was a gap in our training and in the knowledge that we have and in research, I realized that this is something I'm really passionate about. And as I started looking around and talking to people, I realized I'm needed and work in this sector is needed. So here I am. So let's start by defining some terms. Menopause, we say you are menopausal when you've gone 12 whole months without your period. Right? So the normal menopause usually occurs between the ages of 45 to 55 with an average of 51 years old. And if you go into menopause, that means no periods for a whole year before the age of 45, then that's early menopause, right? And then there's another term. If you go into menopause a whole year without your periods before the age of 40, that's called premature menopause, right? So we have menopause that's happening at the normal time of around 51 years old. Then we have early menopause before the age of 45 and premature menopause before the age of 40. So there's so many different signs and symptoms. Some of them you might not even think of, but the most typical ones would be hot flashes and night sweats, trouble sleeping, irritability and mood swings, which sometimes descends into depression and anxiety. Then there's low libido, low sex drive. There's vaginal dryness and recurrent urinary tract infections and vaginal infections. And then there's brain fog and a deterioration of your mental acuity, which sometimes descends into dementia and Alzheimer's disease. And so we also have some which are not so typical that people often get bounced around different doctors for, like muscle pains, joint aches, headaches, such things. They do. Many women only realize that their symptoms are due to menopause years later, when they've seen so many different kinds of doctors and have spent so much money and resources on different kinds of tests, and all she needed was some hormones or some directed alternative treatments. Who is at risk of going into menopause before the age of 45? Most people who undergo that situation, we don't know the cause, okay? So more than 50% of women who undergo it, we are not aware of the cause, right? There's still a lot of research to be done.
Wow.
But in most other women, it's hereditary. So you might suspect that it could happen to you if your grandma, your mom, or your elder sister went into an early menopause. If you're a smoker, you're at risk. If you have HIV, you're at risk of going into menopause about 5 years earlier than you would have. If you had your ovaries removed, both of them, or if you had a surgery to remove a cyst from your ovary and they happened to take out too much tissue and now your ovaries are really struggling to do their job. If you underwent chemotherapy or radiotherapy for a cancer, which damaged your ovaries and now they're not able to keep up with the demand of estrogen. You're also at risk if you have an autoimmune disease like thyroid illness or rheumatoid arthritis or type 1 diabetes. So those are some of the risk factors. Yes, actually endometriosis, because of how destructive that disease is in the pelvis, can ruin your ovaries and lead you to have an early menopause. Even PCOS sometimes can do that. So that's a good question, and yes, it can. That's a good question. The best thing we can do is to work on the risk factors that we're able to control. For example, smoking, right? But you can't change the age that your mom or sisters went into menopause. You can't change the fact that you already have HIV, you're doing your best, you're on treatment. Or you can't change the fact that your ovaries were removed. I'm sure they were removed for a good reason. So all we can do is be able to be aware of these symptoms and seek help early enough, because the sooner you're able to start treatment, the better your quality of life, and in fact, the longer your life will be. So once you suspect that there's something going on, right? I don't even think I mentioned one of the symptoms is having an irregular period. So suddenly your period has changed by up to 7 days or more. So say, for example, if you normally have a 28-day cycle, suddenly your period is now 21 days. Your periods are coming more often than usual, and sometimes they're going to be even heavier. And then with time, they'll become more and more scanty and spread apart. So once you start noticing these things, and maybe the hot flashes, some brain fog that you're ignoring, some vaginal dryness, some low sex drive that you're ignoring and attributing to something else, please see a doctor, right? See a gynecologist, a specialist. And once you see them, book enough time, because that's going to be a really long and deep consultation. They're going to take a very thorough history to get to the heart of your problem. Then they're going to examine you. Then they're going to most likely order some blood tests, okay? So this includes estrogen, which we expect to be very low after menopause. A test for a hormone called FSH. That's a hormone that's being produced in your brain to tell your ovaries to produce estrogen, right? So when your ovaries are not producing estrogen, your brain keeps producing this FSH, like, yo, produce estrogen, and your ovaries are like, no, right? So FSH, we expect it to be very high, okay? And estrogen to be very low. So we're going to test those. We're going to test other hormones like your thyroid hormone and your prolactin hormone, which is also produced in the brain. We're going to screen you for any autoimmune illnesses and just rule out everything to make sure that what we're actually dealing with is an early menopause. And then from there, you might even have an ultrasound scan of your pelvis. And once we have a diagnosis, then we can start the treatment plan. That's a fantastic question, because many women think to themselves, I mean, these symptoms, they kind of suck, but I'm strong, I can deal with it. Or maybe they're not even so bad, right? But here's the thing. A woman who is going into menopause at the age of 50, 51, that's normal. She can decide not to undergo any treatment. That's her choice, right? She can debate about the different kind of treatments she wants. But someone who is going into menopause way early, less than 45 years old, less than 40 years old, you need to be careful. It's not just about treating your symptoms or the hot flashes. You also need to be on treatment to prevent all the complications of early menopause, which include risk of heart disease, risk of stroke, risk of osteoporosis, which is low bone density that predisposes you to fractures, risk of dementia and Alzheimer's, and depression and anxiety, right? So when we're treating a younger woman for menopause symptoms, we're not just simply trying to get rid of her symptoms, we're also trying to prolong her life and prevent all these other complications from coming up. when we need treatment for natural menopause is when you're not feeling okay, when you need help, right? So maybe you're having hot flashes and night sweats, your sleep is a bit disturbed, but it's fine. You're managing, a little irritable at work, but it's fine. You're able to do your work. Brain fog here and there, but you're managing. But if you feel that all these symptoms you're having, vaginal dryness, low sex drive is affecting your relationship and negatively affecting you psychologically, if you feel that you're depressed or really anxious suddenly, then it's time to seek help. And there is help out there. All you have to do is ask for it. Great. So I'm a huge proponent of hormone therapy, right? When someone undergoes menopause at the natural age, we're not replacing the hormones. We're just giving them a little bit of the hormones that they're lacking, which is estrogen, right? So we don't call it replacement therapy in the normal age of menopause. But when you're too young to undergo menopause and you've undergone an early or premature menopause, now we're replacing, okay? We want your estrogen level to be the same as someone your age, right? So that's what we call hormone replacement therapy versus menopause hormone therapy. So hormone therapy is a huge way of treating this condition, and it's such a huge help. Like I said, my friend's mom had tried supplements, she had worked on her diet, she was exercising, she was doing everything right, but still just wasn't able to control these symptoms. And as soon as she started hormones, her life was changed in a couple of weeks, right? So hormone therapy is an option. Okay, so first of all, when we're talking about hormone therapy, there are two main hormones we're talking about, okay? So there's estrogen and progesterone. Estrogen is what your ovaries used to produce, and now they're not producing anymore, right? It can be given in form of a pill, in form of a patch, in form of a spray, in form of a cream for the vaginal area. And then progesterone is also normally given in form of a pill, can be combined with estrogen in the patch. That's how progesterone can also be given in form of an intrauterine device called Mirena that we normally put, and it sits there for 5 years. So whether you're going to get estrogen alone or estrogen plus progesterone depends on whether or not you still have a uterus. Because here's the thing, being given estrogen continuously without progesterone predisposes you to uterine cancer, okay? It makes your uterine lining thicker and thicker, and it can start growing cancerous cells. So if you have a uterus and we're giving you estrogen, we have to give you progesterone in one form or the other. But if you don't have a uterus, if you had it removed for whatever reason, then you can have estrogen alone. Those are the two main hormones we talk about when we are talking about menopause hormone treatment. But also, we sometimes consider giving a very tiny low dose of testosterone specifically for a low sex drive that's negatively impacting your life. That's the thing, it depends on which specific insurance you have and which specific cover you have. But I read that, I believe it's Standard Chartered, they recently, I think it was last year, introduced an employee health cover specifically for women in menopause. Can you imagine? I think they're the first to do it in Kenya. And so they're covering all the drugs needed for menopause in order to help their employees just do better and be okay at work, not suffering. Because you can imagine how many women end up deciding not to continue with their careers, they quit or they go into something less demanding just because of how bad these symptoms are. Imagine you're in the middle of a board meeting, you're making a presentation, and suddenly you have a hot flash, and it's usually described as this really hot feeling that starts at your core and then spreads, and sometimes it often comes like with a panic attack. So you start sweating. It can truly be devastating and frustrating. So some insurances cover, just to get back to the question, and some don't. And you know what? These drugs tend to be expensive, not only the hormone treatments, but also the supplements. So that's something else we really need to do better about.
I love how much you've described. I loved the way that you've described a hot flash, because I always thought it's just a flash.
Right? It's not just like, oh, it's suddenly so hot. No, it's literally coming from inside you.
Oh, wow.
Like your core is on fire. Definitely, that's definitely useful. A lot of the time you need to have a multidisciplinary approach. So you need a counselor or a therapist on board. You might need to be put on antidepressants or an anti-anxiety medications, or some cognitive behavioral therapy, just something to help you cope, something to help you have some coping mechanisms to deal with all this. But if the symptoms are not that bad, most of the time, even just the hormones alone are able to deal with all that. Definitely. I mean, who wants to say, I am undergoing early menopause, right? And many of the times they were planning on having children, but now that your hormone levels are not normal, maybe your chances of fertility are reduced or completely eliminated. It's a really hard diagnosis to make and to take as a woman. It can be hard, it can be challenging. We definitely need support. You need to form a support system, a strong support system, maybe even join some support groups. There's a lot of stigma. No one wants to talk about it. No one wants to come out and say, I'm undergoing early menopause. When you're having a hot flash, no one wants to, be fanning themselves. You feel embarrassed, Just like with PMS symptoms, you're at work and you're minding your own business and maybe you're a bit fatigued or moving a bit slowly and someone says, oh, you must be PMSing. That's first of all rude and unacceptable. But now imagine if it's menopausal symptoms happening a little bit earlier and someone is joking like, oh, you must be undergoing menopause. And then guess what? It's true. That would feel absolutely terrible. So you definitely need to build a strong support system to be able to go through this and make it out to the other side smiling. Here's the thing, right? When men are having erectile dysfunction or some kind of issue due to low testosterone in their older age, they're given all the drugs they need. We replace testosterone in men, so easily. But when women want to enjoy their later years, not only physically but sexually and emotionally, and we just want to have a full life even in our later lives, in our later years, it's so unfair that we're not so quick to jump at a solution like here's what's available, pick a solution, we're here to help you. It's always, you need to be chilling and just waiting for your grandchildren, or you need to not be wanting to have sex. Like, is that really something you want to be doing at your age? That's ridiculous. That's ridiculous. And it's something that I hope will come to an end soon. My message for you is what you're going through is not easy, okay? Yes, you're not the first one to go through it, but that doesn't mean that you have to go through the worst of it on your own. I know that you're always taking care of everyone around you, whether it be your children, if you have children, your parents, you're taking care of your partner and your friends. And when it comes to you for some reason, you're just keeping these things to yourself and not seeking help. I'm here to tell you and to advise you to seek help so that we can take care of you for a change. I want you to be happy. I want you to live a full life, and I know that you can. Follow me on Instagram at Dr. Kenya OB-GYN. And once you find me there, we'll figure out how to find me everywhere else.
Thank you so much.
Yeah.
Guys, this has been Dr. Kenya. If you don't know, she calls herself the OB-GYN bestie.
Yeah.
And I am so glad you came to the Self-Work podcast. I hope you'll be back for another
Thanks
episode.
for having me. Took you long enough, my best friend. Excuse me. I'm so happy to be here. And I'm so proud of you. Look at this.
I'm
Wonderful.
so proud of you.
Yeah.
Thanks, guys. Leave a comment for Dr. Kenya. I will see you on the next episode. Love and light. Bye.
Bye.